Catholic History Trek, a podcast exploring the Catholic past.
When you leave your prayers for the bedside of a patient, you are leaving God for God. Looking after the sick is praying. So said St. Vincent de Paul, one of the great figures of charity in the history of the Catholic Church and one of the founders of the Sisters of Charity. It's this mentality that's at the heart of the long and storied history of care for the sick in the Catholic Church, the topic of this episode of Catholic History Trek. I'm Kevin Schmeezing, giving Scott a break today. Care for the sick is at the heart of the Christian message, has been since the very beginning. If you read the Gospels, you know that miraculous healings were a big part of the ministry of Jesus Christ. Compassion, in fact, compassion for the sick, has been a distinctive contribution of Christianity to world history. The abandonment of the weak and the sick was not uncommon in the ancient world, and you can still find it in many non-Christian cultures all the way through the Christian era. Now, during most of the period we're talking about, medicine was not a sophisticated profession. We didn't understand a lot about how disease was spread. We didn't know a lot about how to cure it. And so the chief need was simply routine care, to accompany the sick, to tend wounds, to provide food and water. These were the needs that the sick had, and these were the needs that Christians provided. Christians distinguished themselves during the Roman plagues of the 2nd and 3rd century. There was a great plague during the 3rd century, known to history as the Plague of Cyprian. During that pestilence, some 5,000 people in the city of Rome were dying per day, and it was similar in Carthage and Alexandria. These were the great cities of the Roman Empire at the time. Now, the Christians already had a ministry called the diaconate. You can find deacons described in the New Testament in the Acts of the Apostles. And during these plagues, deacons took on the role of organizing care for the sick. They were also concerned to bury the dead. The Plague of Cyprian was named after the Bishop of Carthage in the 3rd century, named after him not because he caused the plague, but because the bishop was a major public figure. And Cyprian of Carthage wrote about this experience afterwards in a document known as the Treatise on the Plague. One passage from it reads as follows: "Beloved brethren, what is it? What a great thing it is, how pertinent, how necessary, that pestilence and plague, which seems horrible and deadly, searches out the righteousness of each one, and examines the minds of the human race, to see whether they who are in health tend the sick, whether relations affectionately love their kindred, whether masters pity their languishing servants, whether physicians do not forsake the beseeching patients. Although this mortality conferred nothing else, it has done this benefit to Christians and to God's servants, that we begin gladly to desire martyrdom as we learn not to fear death. These are trainings for us, not deaths. They give the mind the glory of fortitude. By contempt of death, they prepare for the crown." So, Bishop St. Cyprian saw the plague of the 3rd century as a test for Christians, a test of the fortitude and endurance of their faith. Gary Ferngren, professor of history at Oregon State University, has written that the compassionate model in healthcare is the very distinctive contribution that Christians have made. He has further claimed that the evidence is overwhelming that the hospital was a specifically Christian institution, lacking in any other culture. The beginnings of our modern institution of the hospital can be found in the 3rd century with St. Basil of Caesarea. He created an institution called the Basiliad, generally recognized as the first hospital in the world. It was founded for lepers, but it gradually expanded to care for others, including orphans and sick people more generally. After the death of St. Basil, St. Gregory of Nazianzen said in his funeral oration that Basil took the lead in pressing upon those who were men that they ought not to despise their fellow men. Others have had their cooks and splendid tables and the devices and dainties of confectioners and exquisite carriages and soft flowing robes. Basil's care was for the sick, and the relief of their wounds and the imitation of Christ by cleaning leprosy not by a word, but in deed. It was a similar story in the West. St. Fabiola, generally recognized as the founder of the first hospital in the Christian West. She was a wealthy widow who lived in Rome in the 4th century. After her death, her contemporary St. Jerome said that she was the first person to found a hospital into which she might gather sufferers out of the streets and where she might nurse the unfortunate victims of sickness and want. Often did she carry on her own shoulders persons infected with jaundice or with filth. Often, too, did she wash away the matter discharged from wounds which others, even though men, could not bear to look at. She gave food to her patients with her own hand and moistened the scarce breathing lips of the dying with sips of liquid. The carriers of this tradition of Christian care for the sick into and through the Middle Ages were primarily the monasteries and the monks who lived there. St. Benedict, the great founder of Western monasticism in the 500s, posited that hospitality was a major charism, a major function of monasteries. And so most monasteries included guest houses. These guest houses, one of their functions was to care for the sick. Many of you will be familiar with the breed of dog, that big dog called a St. Bernard. Well, the St. Bernard was developed as a rescue dog to serve in the Alpine passes in Switzerland and Italy and France. Great St. Bernard Hospice in southern Switzerland, still there today. It was founded by St. Bernard of Menthon in 1050. And St. Bernard and St. Bernard Hospice, the monastery, gave their name to the breed of dog. From the Benedictines on, religious orders have played a leading role in healthcare and hospitals and related institutions like homes for the elderly and hospices, really almost all the way down to the present. Around the time of St. Bernard of Menthon was also the time of the Crusades, and the Crusades were an impetus for the founding of healthcare institutions as well. There were crusading orders that were founded to care for pilgrims to Jerusalem, and then later for the Crusaders themselves. The Knights of the Hospital of St. John, the Hospitallers, one of the best known. This history is still being unfolded, interestingly, just relatively recently in historical terms. In August of 2013, a team of archaeologists from the Israel Antiquities Authority discovered a 1,000-year-old Crusader building in the Christian quarter of the old city of Jerusalem. That building was a busy hospital during the Crusader period, so the 1100s and 1200s. The directors of the excavation, two archaeologists, described it. They said the structure seems to extend across an area of 15,000 square meters. Its construction is characterized by massive pillars and ribbed vaults, and it stands more than 6 meters high. Further, they say, we have learned about the hospital from contemporary historical documents, most of which are written in Latin. These mention a sophisticated hospital that is as large and as organized as a modern hospital. Religious orders continued to serve the sick into the modern period. St. Camillus in the 16th century was injured during military service and then decided to devote himself to care for the sick. He founded the Ministers of the Infirm, or the Camillians. Now, on their habit, prominently on the front, is a red cross. And although it has not been confirmed, there's speculation that this was the origin for the symbol of the Red Cross as being the universal symbol for care for the sick. Around the same time, St. John of God, a similar story. A former soldier devoted himself to the sick. He founded the Brothers Hospitaller of St. John. Eventually, women's religious orders also got into this ministry. They didn't in the beginning because women's religious orders were almost entirely cloistered, and so they were not able to interact with the world in a way that would allow them, for example, to participate in hospital ministry. But beginning in the Catholic Reformation period in the 16th century, more active women's religious orders began to be formed, and it was women religious who staffed the earliest hospitals in North America, in the cities of Quebec and Montreal. Florence Nightingale, a name familiar to many as the founder of modern nursing, she served during the Crimean War in the 1850s. Well, when she was working during the Crimean War, she was accompanied by English Sisters of Mercy, who were doing the same work that Nightingale was doing. The earliest health care in the United States was not Catholic because the church had no institutional presence and so no religious orders and no hospitals or orphanages. But that began to change quickly over the course of the 19th century. In 1823, the University of Maryland opened the first modern hospital in the United States. It was known as the Baltimore Infirmary, and on its staff were 5 Sisters of Charity from Emmitsburg, Maryland. This was the group founded by St. Elizabeth Ann Seton and modeled after the Daughters of Charity, who were founded by the aforementioned St. Vincent de Paul, along with his co-founder, St. Louise de Marillac. The same congregation supplied sisters when the Melanphy Hospital in St. Louis opened its doors as the first hospital west of the Mississippi in 1828. Sisters were pioneers in nursing care in many cities and across the frontier. Besides the places already mentioned, sisters founded the first hospitals in Chicago, Milwaukee, Boise, Salt Lake City, Portland, Oregon, San Antonio, and many other places. I've mentioned before the book that I'll have coming out in early 2022. There's a chapter in that focuses on the story of Mother Joseph of the Sacred Heart, who in 1858 established the first permanent healthcare institution in the Pacific Northwest, St. Joseph Hospital in Vancouver, Washington. The Providence Health System is still operating in the Northwest today, and in fact it was at Providence Medical Center in Everett, Washington, that the first documented COVID case in the United States was treated, just about a year ago, as I'm recording this in March of 2021. During the Civil War, more than 600 women from 24 religious communities, including the Sisters of Mercy and Sisters of Charity, served on both sides of the conflict. They were honored with the erection of a memorial in Washington, D.C., the Nuns of the Battlefield Memorial, constructed in the 1920s. And engraved there it says, "They comforted the dying, nursed the wounded, carried hope to the imprisoned, gave in His name a drink of water to the thirsty, to the memory and in honor of the various orders of sisters who gave their services as nurses on battlefields and in hospitals during the Civil War." St. Frances Cabrini, the first U.S. citizen to be canonized, with her missionaries of the Sacred Heart, founded many hospitals across the United States. In fact, it was at one of her hospitals in New York City that the healing occurred in 1921 that would be the miracle for the beatification of St. Frances Cabrini a few years later. In 1914, the founding of the Catholic Hospital Association organized nearly 600 Catholic hospitals across the country. The Catholic Health Association, its continuation in the present, comprises more than 600 hospitals and 1,600 long-term care and other health facilities in all 50 states. As such, the Catholic Health Ministry is the largest group of nonprofit healthcare providers in the nation. Care for the sick, one of the Church's corporal works of mercy, and one of the great ways that Christians have witnessed to the love of Christ over the 2,000-year history of the Catholic Church. Gloria Patri et Filio et Spiritui Sancto, sicut erat in principio et nunc et semper, et in saecula saeculorum. Amen.
Thank you for listening to Catholic History Trek. You can reach us at catholichistorytrek@gmail.com.